It's a common misconception that people have that reflux is caused by too much acid. And of course, people quite reasonably think that's the case because the standard treatment is to give people really powerful antacid tablets. Now, these tablets can be very effective for many patients, but for perhaps a third of those who are prescribed PPIs to treat reflux symptoms, they still have symptoms. And the reason for that is quite simple, insofar as the real fundamental issue with reflux is that the valve at the bottom of the esophagus fails. So we have a valve at the bottom of the esophagus which is designed to keep acid and other components of the gastric juice in the stomach to keep it away from the esophagus. And when that valve fails, then acid and gastric juice can come back up. It can cause symptoms with burning, regurgitation, and if it reaches the throat, it can cause what we call a laryngopharyngeal reflux with problems with the voice, a lump in the throat, sore throat, bad breath, a persistent cough, a whole host of symptoms. So in order to treat that, one option is to repair the valve, to recreate and help strengthen the normal barrier which keeps acid in the stomach. And that's what anti-reflux surgery aims to do. And whether or not patients choose to have a fundoplication operation, which is the procedure which has been around for 30 years or so, or whether they choose more modern technology, in Anna's case, she chose to undergo LINX. In both of these procedures, the aim is to restore the lower esophageal sphincter mechanism. So in the LINX device, a small bracelet of magnetic beads sits around the bottom of the esophagus. When patients swallow, those beads separate and allows food to fall from the esophagus into the stomach, and then the beads close behind, strengthening the normal lower esophageal valve mechanism, and that then helps to make sure that acid can't then regurgitate reflux from the stomach into the esophagus. When Anna and I first met, we discussed the potential options for her treatment, including continuing as she was with the antacid tablets which weren't working very well, or the interventional options. And there are several, including the Stretter procedure, fundoplication and the LINX. And following that discussion, Anna's preference was LINX surgery. Like many patients, she chose LINX because it's minimally invasive. It doesn't involve sewing parts of the stomach to each other. The side effects which can affect the fundoplication operations, in particular difficulty belching and vomiting and bloating that can happen after surgery, those don't tend to occur following LINX surgery, and the outcomes seem to be really good. When we first started doing the operation, we literally had to say to people, we do not know what the outcomes are because this is a new technology, but it's been around 10 years now, and there's a lot of published data, and we're pretty confident that 5 years following the surgery, 85% of patients will remain off the PPIs and be symptom-free. So this was Anna's choice, and following that discussion, we then proceeded to arrange investigations to obtain some objective data to confirm the diagnosis and to make sure that the esophagus was working normally, and that should she decide to proceed with LINX implantation, that she'd be able to swallow normally afterwards. So she underwent those tests. The first set of tests, which incidentally measures both acidic and non-acidic reflux, interestingly showed a strong correlation between Anna's symptoms, but didn't actually demonstrate clear evidence of reflux. And that can happen sometimes. And very often at that stage, patients are told, well, you don't have reflux, your symptoms aren't secondary to reflux, there's nothing we can do to help you. But in Anna's case, we then, because we were so confident that her symptoms were related to her hiatus hernia, were related to a reflux disease, we therefore then proceeded to perform a further test, which is called a Bravo test. This involves putting a little capsule at the bottom of the esophagus, and it captures data over 48 hours, and this was strongly positive. It provided clear evidence of reflux. So I'm pretty confident that Anna is going to benefit.